what was the easiest thing for you? What did you discover while working with communities you're not part of, because you're not an Eastern European yourself?
No, that's such a great question. What I discovered has been really impactful is having someone on the team who's actually from the community. So when we've gone into the community, we've wanted to start forming relationships and build trust. And what's really helped is having someone actually from the community. So we have a Romanian individual who's been hired on as a community connector for our project. And she's really been a key element in connecting in with the communities locally, kind of bringing that familiarity and trust and being able to speak a familiar language for many around Northamptonshire, as Romanian is one of the biggest cultures of Eastern Europe that we have within our community. And it's been really great to actually also go in person and just speak to people and make that face-to-face connection and have casual conversations and just get to know local businesses and families and individuals locally, so that when we do need to engage, it can have some great meetings.
Yeah, it's great because even before ending this project, we discovered that people don't really know about research and how they can get involved in research. And we also discovered they don't really understand how the system works and they lack some information they should have from trusted sources.
Yeah.
So we use make every contact count approach to make sure they understand more about vaccination, about the NHS, how to work with the local authorities, where to search for some services. Not just, it wasn't just about research.
Yeah, no, it was really, really impactful. And do you think that it's brought a lot of benefit to the project to have provided information in people's own languages?
Yes, I think it was very useful, and the feedback we had during the project while we implemented it was great. People are really relieved to find information that's correct and from a trusted source in their own native languages, which we didn't have beforehand.
So I guess one question I can ask you is what you think a big impact has been in terms of our project and the journey we've gone so far.
I think the biggest impact for me is actually getting into the communities, into our Eastern European communities, and understanding the needs of the community and actually responding to those needs, responding to what the people have told us. And that's been the big impact that I've seen from this project. Even from today's event, the people, the number of people that have turned up, and even speaking with the various individuals, they appreciate the fact that we've come into the community rather than expecting the community to come to the NHS. We've listened to what they've told us and we've actually done what they've told us. We've come into the community, we've got the local food, local entertainment. That's been a big impact of this project. And just coming back to you, Gabby, how have you found actually doing the work on the ground with the communities? What would you say has been the learning point for you from doing on ground?
Yeah, so it's been really interesting to actually be out in the community, and I found a lot of impact in being in person, face to face, just speaking to individuals. That we've done these community mapping exercises where we've gone into different town areas within Northamptonshire and just taken the effort to speak to different businesses, families, individuals that we've had in the community. And it's been really impactful because when we've returned to those locations or to those services, we found some really good connections and some really genuine sort of trust that we've been able to build upon, so that when we did want to bring our information and spread it within the community, we had lots of willing parties who were happy to have those information brought to them and were interested in sharing on with those that they knew.
And I think the next step for us is maintaining the relationship we have with the community. So looking at how we can sustain what we've built up here now at the end of the project, and not just letting those relationships fall by the wayside, but building on top of the relationships we have with the communities.
Yeah.
So that will be our next step, is really looking at sustainability and just really building on the relationships and the trust that we've built in the communities.
Definitely, and I think it's making, hopefully we have that lasting impression, like Anita says, and I'm really excited to see what happens in the future. And now that we've had a great base to start on, I think there's some really exciting things in the future. So.
Absolutely, and I think it just goes to show that when we say people are hard to reach, they're actually not hard to reach. We just haven't gone out to find our communities where they are, and this is a testament to the fact that when we do the work and actually go out into our communities and look for our communities that we say are hard to reach, but actually are just underrepresented, when we go out into the communities where they are there and they're willing and they're just really eager and excited to be part of what the NHS is doing, as this has a big event today has shown. So I'm excited for the future.
Yeah, I know, really wonderful.
One of my expectations was to help as many people as I could, and even if the project was on short time, just 5 months, I think we did a great job.
What comes after? That's a really good question. So after today, we will be collating all the surveys that we've done, pulling together all the information that we've got on our outreach and from this event, and we will be writing a really good comprehensive report that will go back to NHS England and hopefully give them some really good recommendations about how they can engage with the East European communities.
Me and Gabby, we just clicked from day one. Both of us wanted to make things happen in the Eastern European community and to make a big impact and to bring all the people together in the same time so that they feel included.
Yeah, I think it took a really good working relationship. Together, we were able to handle it so well, and it just took that good teamwork and, that good element of just trust and like good communication and, a little bit of fun in there as well, and being able to laugh and also being able to, focus in when we needed to on our different tasks. But I think it took a lot of just work, but in a really great way. I think my advice to anyone who wants to look at a project like this one is to pick a good team full of individuals that you can trust and that can work together really dynamically.